Is it normal to bleed after your period?
Hello, everyone. Today, we're going to be discussing a common question that many women often ask. Is it normal to experience bleeding 1 week after a period? This topic is important because understanding our bodies can help us identify when something may be amiss.
What is normal menstrual bleeding?
Typically, a menstrual cycle lasts about 28 days, but it can vary from 21 to 35 days in adults and from 21 to 45 days in young teens. The period itself usually lasts between 2 to 7 days. Bleeding that occurs outside of this regular period is generally considered abnormal uterine bleeding.
Possible causes of bleeding after a period.
If you're experiencing bleeding a week after your period, it may be due to various reasons. Here are some of the most common ones. 1. Ovulation. Some women experience light spotting during ovulation, which usually occurs in the middle of your menstrual cycle. 2. Hormonal fluctuations. Changes in hormones can cause spotting. This is common when you're starting or stopping hormonal contraceptives. 3. Uterine fibroids or polyps. These non-cancerous growths in your uterus can cause spotting or heavier periods. 4. Sexually transmitted infections, STIs. Some STIs, like chlamydia or gonorrhea, can cause bleeding between periods. 5. Stress. Emotional or physical stress can cause changes in your menstrual cycle, leading to spotting. It's important to note that while these causes are fairly common, post-period bleeding could also be a sign of more serious conditions, such as endometriosis or, in rare cases, uterine cancer.
When to seek medical help.
When should you be concerned about bleeding after your period? Here are some signs that you should consult a healthcare professional. The bleeding is heavy and requires you to change your pad or tampon every hour. You're experiencing severe pain. The bleeding continues for several days. You also have symptoms of an STI, such as unusual vaginal discharge, pain during sex, or lower abdominal pain. You're feeling faint or dizzy, which could be a sign of significant blood loss. In conclusion, while it's not uncommon to experience some bleeding or spotting between periods, it's always important to listen to your body and seek medical advice when something doesn't seem right. Remember, your health is paramount, and there's no need to feel embarrassed or hesitant about reaching out to healthcare professionals with your concerns. Stay healthy and informed.